Hey everybody, welcome back to the ECG of the day. My name is Reid, and don't forget that you can download this PDF document of this ECG down in the description below. And don't forget to like this video and subscribe to the channel if you enjoy the content. So let's jump into it. So this is a very funky ECG. You'll notice this is not typical. There are plenty of QRS morphologies, and so as we're approaching this ECG, we're going to kind of go about things a little bit different, okay? Because we've got a lot to work through. So first thing I notice when I look at my forest is that I come down here to maybe V5, and I see I've got this kind of repeating pattern of QRS complexes, right? And I'm going to label them in certain numbers to kind of help. So you see that my first QRS complex, I'm going to label 1. The next QRS looks different. I'm going to label this 2. The next QRS looks the same as that first one, so I'm going to label it 1 again because it's the same morphology. And then the last QRS I'm going to label 3, right? So those are kind of our, the pattern that we see, right? We've got the same pattern. That QRS morphology, it changes again, it goes back to the original, and then it changes again, right? We'll do that one more time where we have 1, 2, 1. This is just going to help us with our organization, right? We'll do that all the way through. Okay. My average rate here, you're probably like, well, how do I calculate a rate? Well, my rate, what I'll do is I know my interval is 10 seconds, so I'll just count the number of QRS complexes. So I've got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, so I can do 15, and I know that in there's 6 groups of 10 seconds in a minute, so times 6, and 15 times 6 is, what is that, 90 beats per minute. Okay, so that's our average rate here. And so I'm going to just glance in front of these QRSs. You know, what is my thought here? Well, I know that number 3, so I'm going to label these over here, and we're just going to kind of put some data points about each of them. Try to help figure out what's going on. So I know that number 3 comes premature, right? It's a premature beat, and there's a little bit of a pause after. You can see that pause. It's a premature beat. It's wide complex compared to my baseline are all wide as well, right? These are all wide, so we'll say wide, wide. And 3 is premature and wide. And I look in front of it to look for atrial activity, and I don't see any, right? I don't see any atrial activity. I can scan through all the other leads. And so I would say that beat number 3 is a premature ventricular complex or contraction, PVC, okay? So we know that we have PVCs, and they're occurring every 4th beat, right? We have 1, 2, 3 PVC, right? And so it's happening in every 4th beat, and so that's, we would call that something called ventricular quadrigeminy. Okay? That just says that we're having a PVC every 4th beat. Okay? Next thing I'm going to do here is start to figure out what's going on with beats morphology number 1 and beats morphology number 2. So I look in front of them to see are there P waves, and I think there are, right? If I come all the way up to lead 1, if I trace all of these up, right, remember each of these are the same beats. In front of them I have P waves. I have a P wave there. I've got a P wave there. So I have P waves in front. And those P waves are upright in lead 1, and they're upright in AVF. So we do have sinus P waves, right? That are coming from the atria. They're going down to the left, captured by the AV node. So these wide complex beats, number 1 and 2, I'm guessing that these are aberrantly conducted beats, right? You can see that they're wide, so that's what our thought is, right? And so we have figured out what our atria is doing. what is the ventricles doing? And we know that before we get there, let's see what the AV node is doing. And so our PR interval, if we measure our PR intervals, they all seem to be a little bit on the long side, right? A little bit on the long side. And so you can see those PR intervals are all greater than 200 milliseconds. So I'm just going to call this, because I don't see any P waves that don't conduct, I'm going to call this a first degree AV block. Every P wave has a QRS. It just takes a little longer to get there. Okay? So we have first degree AV block. And now let's evaluate that QRS. This is where we're going to be making our money, right? And so what I'm going to need to do is I'm going to need to define, if I think these are aberrantly conducted QRS complexes, I'm going to need to define the morphologies of these. So what am I doing? I'm looking for left bundle branch blocks, right bundle branch blocks, bifascicular blocks, right? I'm looking for what is the morphology. So let's focus on beats number 1, okay? So beats number 1, those morphologies, if you look in leads number 1, for morphology number 1, if you trace it up, you see I've got an R, R prime. So I've got an R, R prime in lead 1. If I do the same thing in AVL, if I trace this up to AVL, you see I've also got this R, R prime. And if you trace it up in my precordium, you see I've got, if I go all the way up to V5 and V6, I've also got in V6 this kind of R slurry kind of R wave, R prime. And so that makes me think that beat 1 has late forces going towards the lateral leads. And so I'm thinking maybe lead 1 is a left bundle branch block. Excuse me, beat 1 is a left bundle branch block. And you can even see if I come here to my beat 1 up in V1, you can see I lose my septal R wave. I have no septal R wave. And that occurs because the left bundle actually supplies the septum, and so we lose our septal R wave. And so that kind of confirms we have a left bundle branch block. So we have an alternating left bundle branch block, right? Because that happens every time beat 1 occurs, we get a left bundle branch block. And so then what happens at beat 2? Because beat 2 does not look the same, right? But we think that beat 2 is caused by a P wave that conducts to that QRS. And so I'm looking for maybe, is this another bundle branch block of some sort? And interestingly enough, if you follow lead 2 up this way, beat 2 up this way, you can see that in leads V1 and V2, we have an R, R prime. We have an R, R prime. Right? In V1 through V3, we've got these R primes. And we know that that morphology is more consistent with a right bundle branch block. That's interesting. Right? Because those are telling us that our late force is going towards V1, V2, V3. And if you look in the limb leads for beat number 2, and I trace this up, you see that the axis of my QRS for beat number 2 is upright in lead 1, but negative in lead 3, and also negative in lead 2. So it's actually got left axis deviation. So we've got a left axis deviation in the setting of a right bundle branch block. This also is a left anterior fascicular block, right? So this is a bifascicular block morphology, right? Because we've got that upright in 1 and then this down going in 3. That tells us that we've got a bifascicular block pattern for beat number 2. And so why are we getting all these morphologies of these beats? Well, this is a really incredibly rare finding where we have a sinus rhythm with alternating left bundle branch blocks with bifascicular blocks. So it's alternating back and forth. And then that is reset. Each cycle is reset by these quadrigeminal premature ventricular contractions that occur every fourth beat. And so what's happening is that with every single beat, this individual's conduction system is alternating in which aspects are refractory. So for the first beat, the left bundle is completely blocked. For the second beat, the left bundle seems to recover but the anterior fascicle of the left bundle is continuing to be blocked, and this time our right bundle is blocked. So you're getting this alternating pattern between the left bundle branch block and the right bundle branch block plus left anterior fascicular block. So you're getting alternating between those two with these quadrigeminal PVCs. So this is an incredibly advanced ECG. This individual has a lot of disease of their conduction system, right? That with a normal sinus rhythm, they have these fluctuating bundle branch blocks, right? And so that tells me that with each beat, we have changing ability for these fascicles and bundle branches to conduct this signal. And so this person probably needs a workup. They probably need an echocardiogram. They probably need a stress test. They probably need a Holter monitor. They likely are going to need, maybe even more advanced imaging, cardiac MRI, cardiac catheterization, because you might think that this is probably due to kind of severe underlying coronary artery disease, where this individual has probably got some ischemic changes chronically that are damaging the tissues and altering their ability to recover on time. And so that's why you get these alternating morphologies. So I hope this helps you kind of understand what's going on with this ECG. It's really complex, but we'll kind of leave it at that and study it, ask questions, put them in the comments. And once again, thanks so much for watching, and hope you have a great rest of your day. We'll see you on the next ECG video. Take care.